Today the doctor has ordered Coumadin 5 milligrams PO daily for atrial fibrillation for my patient Linda Belcher. According to the diagnosis and the medications, those do correlate and the order is signed. My first medication check is done. Going to my second one, going to the Pyxis. I do have my oral dose of Coumadin 5 milligrams. It is not expired for my patient. Now we will go into the room. Knock, knock, knock. Hello, my name is Raylen. Pull the blinds. I will be your nurse today. I'm here to give you your dose of Coumadin for your atrial fibrillation. Have you ever taken Coumadin before? Oh, you have? Okay, so just kind of give you a recap. It is your blood thinner for your atrial fibrillation. We have checked your PT and your INR. I'm sure you are familiar with what that does and what that indicates of your medication. So those levels are good, and we're able to give you your dose today. Do you mind stating your name and date of birth for me? Linda Belcher, 9472. Awesome. And do you have any drug allergies? No? Okay. Let's spit in, scan. Do you have any issues swallowing medications? No, just take one sip for me though. Went down just fine. Awesome. Okay. Open this up. And here you go. Okay, and like I said, that this medication does thin your blood. So side effect is bleeding. So if you see any blood in your urine or stool, please give us a call and we will come assess you. Okay, let me just document that I gave you your medication. Okay, that sounds good. And just further education, since you are being discharged on this medication, vitamin K is an antidote. So do you eat a lot of salads? Oh, you do? Okay. So just don't eat any more than you usually do. It is great to be healthy and eat healthy, but it is the antidote, so it will make it work less, okay? Also, it is a very high-risk drug, so make sure if you're taking any other supplements, medications, you talk to your doctor first, okay? All right, here's your Colate. And is there anything else that I can do for you? No? Okay, have a great day. Today the doctor has ordered Tylenol 500 milligrams PO for a headache of my patient, Jean Simmons. According to the diagnosis and the medication, they do correlate and the order is signed. My first medication check is done. Going to my second, I will pull out the medication from the Pyxis. It is a PO dose of Tylenol 500 milligrams. It is not expired. My second medication check is done. Going into my patient's room. Knock, knock, knock. Hello, my name is Raylen. I will be your nurse today. I'm here to give you your Tylenol for your headache that the doctor has ordered. What is your pain level out of 1 to 10? An 8? Okay. You describe the pain. Is it sharp, dull, achy? Dull? Okay, where is it at on your head? Right in the back? Okay. Has Tylenol helped in the past to make it better? Yeah? Okay, perfect. And do you have any allergies to drugs? No? Okay, and we did check your blood levels. Your liver function, your renal function are fine to continue this dose. So can you please verify your name and date of birth? Jean Simmons, 10/31/66. Awesome. Do you have any problems swallowing pills? No? Can you just take one sip for me to verify? Perfect. Okay, let's get you medication. I'm gonna scan it, put it into the MAR, open it up. Here you go. Okay, and then I'm going to document it. Alrighty, so just because this is an over-the-counter medication, you will be able to purchase it as you please since it does help your headaches. Just let you know, avoid alcohol when taking this medication. Make sure you're keeping track of how much you're taking and reading the label that's on the bottle so that you're not taking too much, okay? All right, is there anything else I could do for you right now? No? Okay, here's your Colate. I will come back later to check on your pain, okay? Thanks. Today, the doctor has ordered prednisone 5 milligrams PO daily for 3 days for my patient John Doe for his allergic reaction. According to the order, the medication makes sense with the diagnosis. The order is signed by the doctor. My first medication check is done. Going to my second is pulling out the Pyxis. where I have oral dose of prednisone, 5 milligrams. It is not expired, and it's for my patient. I'll be going to the patient's room. Knock, knock, knock. Hello, my name is Raylan. I will be your nurse today. I'm here to give you your prednisone for your allergic reaction. This is a steroid. It's an it just decreases the immune response that your body did have to something that you may have been allergic to. But have you ever taken this medication before? Yes? Okay. All right, so just some side effects for you. It does kind of increase your appetite, makes you a little restless, keeps you awake. You can have some nausea, vomiting, and abdominal pain. If any of those happen, please just give us a call and we will come to help you. And then can you verify your name and date of birth? John Doe, 8/1994. Okay, and do you have any allergies? Oh, to penicillin? Okay, what happens there? You get a rash? Okay, perfect. Okay, so do you have any problems swallowing? No? Okay. Do you mind just taking this for me? All right, that go down okay? All right, perfect. So let's scan my medication. Here's your dose of prednisone. Okay, just document it in the computer. Perfect. Okay, so just give you some education. This medication does have more of adverse effects when you take it long term, like osteoporosis or adrenal insufficiency. But so far we're trying to just give you a dose for 3 days, which is, it does have some long-term effects to it. But hopefully we can stop this allergic reaction now and not have to do this again, correct? All right, awesome. Well, is there anything else I can do for you? No? Okay, here's your call light. I'll be back to check on you, okay? Today the doctor has ordered Percocet 325 milligrams, PO for my patient Bono for pain. My first medication check is this order. The doctor did sign it, so that is done. Going to my Pyxis, since this is a narcotic, I will need to count the medications already in there and document the ones I did take to make sure it all matches up. Where I got my PO dose of Percocet, 325 milligrams, I'm taking one, and it is not expired. So now I will go into my patient's room. Knock, knock, knock. Hello, my name is Raylan. I will be your nurse today. I'm here to give you your dose of Percocet for the rib pain from the motorcycle accident. Can you tell me your level of pain from 1 to 10? You're at a 9, okay. Can you tell me, is it just in the ribs? Is it going to the back? Like, where's the pain at? Just mostly on the left side. Okay, is it sharp, dull? Sharp, okay, perfect. All right, so have you ever taken Percocet before? You have a long time ago? Okay, just the side effects are dizziness, drowsiness, and can cause some constipation. If that does happen, just call us, let us know. Maybe we can get you some stool softeners to help you go. Otherwise, if you are getting up and you do feel dizzy, please give us a call so you do not fall. We can help you to the bathroom, help you get up, and such sorts, okay? All right, can you please verify your name and date of birth? Bono, 12/25/70, awesome. Do you have any drug allergies? No, okay. Scan the med. Open it up. Do you have any problems swallowing? No. Can you just take one sip for me? Okay, go down. All right. All right. Here is your medication. Perfect. Just document that. Awesome. All right. Well, you will probably be discharged on this medication. So just let you know, when you are at home, please do not drive, operate heavy machinery, anything of that sort. If you do need help getting up and walking, I advise having someone assist you so you do not fall and cause further damage, okay? All right, is there anything else I can do for you? No? Okay, here's your call light and I will come check on you later. Sanitize. Today the doctor has ordered naloxone hydrochloride, 0.4 milligrams IM stat for my patient Ara Stark, who has an altered level of consciousness. She is unconscious right now, but it's report that Deb is at bedside. So my first medication check is my order, which the doctor has signed, and the medication correlates with the diagnosis. First medication check is done. Going to my Pyxis, I'm going to pull out my Narcan, and per the bottle, 0.4 milligrams equals 1 milliliter, so I will draw out 1 milliliter. sanitize. My medication is not expired, and I will clean the top. Pull out my syringe. Bring out air. Inject. Push in the air. Pull out 1 ml. Okay. Sweep and cap. And now I will go to my patient and administer my medication. And I will take my syringe, hold my hand up so people know that I have the sharps in my hand. Knock, knock, knock. Hello, my name is Raylen. I will be your nurse today. Is this Aria? Okay, Dad, can you kind of let me know what happened here today? Okay, you found her on the ground. Okay, does she have any history of mental health? Yeah, oats and depression. Okay. All right, so I'm going to give her a dose of Narcan that the doctor has ordered. It reverses an opioid overdose. A big side effect is they become very nauseous when they get up, so I'm going to hand you this trash bin. And after I give it, she may kind of come out gagging and vomiting, okay? All right, and can you verify her name and date of birth for me? Aria Stark, 8/9/2000, awesome. And does she have any drug allergies? No? Okay, perfect. So this is an IM injection, which means intramuscular. I am going to do it into the leg, the fleshier part of the leg. And let me just get started. I'm going to sanitize my hands. Sorry, my cap fell on the floor. I'm going to be careful. And scan in my medication into the MAR. And we are doing the leg. We're going to find the fleshiest part, administer there. I'm going to take my alcohol swab, go out into out, go out in a 90-degree angle, and inject. And I will one-handedly recap, put that, dispose of the sharp, place the Band-Aid over. Okay, looks like, okay, she's coming to. Yeah, just hold that trash can next to her, and we will come in to check on her, okay? All right, is there anything else I can get for you? All right, the call light's bright. If there's anything else, let me just document the medication. Okay, perfect. All right, just give us a call if you need anything, okay? Okay. The doctor has ordered 1 glass of Ambul IM to my 8-year-old patient, Julie the child, for a burn to her hand. My first medication check is done by checking the order. The doctor has signed it. Now going to the Pyxis, where I will get my medication, which is IM, in the correct medication, and is not expired. Now we will see the patient. Knock, knock, knock. Hello, my name is Raylen. I will be the nurse today. Are you Mom? Hi, Mom. We're going to give Miss Julia here a dose of Ambul for the burn to the hand. How are you feeling? You okay? All right, we're going to give you some medicine, hopefully make you feel better. It's going to be an IM injection. I'm just going to do it to the glutes, so just preference aside if you can put her on her stomach. But first, we will, if you can verify her name and date of birth. Julia Child, 12/12/12. Awesome. And does she have any drug allergies that you know of? No? Okay. If you don't mind helping her get onto her stomach and just hold her hands, I will get prepared with all my medications, and then we will get started, okay? Okay. So, I will sanitize my hands, get on my gloves. The Ambul will have to break open. So pull it towards me and I will hear it crack. And I will use a filter needle for this and leave the other needle in here. So filter needle is on here and I will get it out, pull it out, pull all that I can out. Okay. And then I will, since my needle is still sterile in here, I will reattach it back to the needle to inject. And I have to scan the printed medication label that the Pyxis printed for me. Scan that. Okay, and we are going to do the glute. We are going to make the Y up on the back here, like this. We're going to get into the middle of that V section in a very fleshy part. So I will use alcohol swab out into out, and then I will uncap the needle, stabilize, inject at a 90-degree angle, give the dose, one-handed recap, use 2 fingers, pull it down, discard in the sharps, place a Band-Aid on the patient, and okay, how did that feel? Is that okay? All right, sorry, yeah, I know that did sting a bit. All right, well, I hope you are feeling better. Please give us a call if you do need anything else or if symptoms worsen. Okay, otherwise, is there anything else I can do for you today? No? Okay, well, I hope you feel better, okay? And sanitize out.